Hi, my name is Devin Chandler, and I did lower abdomen surgical rehab for my Sports Medicine 3 project. So, here's an overview of the surgeries I researched. I did an appendectomy and a cesarean delivery, otherwise known as a C section. So, an appendectomy is the surgical removal of one's appendix. Appendicitis is often the main cause of an appendectomy, as it's dangerous to keep your appendix after infection or inflammation. And C-sections are an alternative to natural birth because natural birth could be harmful to the mother or the baby. So the first one we'll be going over is an appendectomy. So appendicitis occurs when your appendix, located toward the lower right stomach, becomes inflamed. The appendix serves no specific purpose to the digestive system, therefore it will not affect you if it is removed. So there are two different surgical procedures that are used to remove the appendix, which include an open and a laparoscopic appendectomy. An open appendectomy is when there is only one incision used to remove the appendix, while a laparoscopic uses three small incisions and a tool called a laparoscope. The surgeon will use the laparoscope to see the appendix and then proceed to tie it off with stitches and remove it. Appendicitis is a fairly common condition and it occurs in nearly 7% of the population. So, for the recovery process after getting an appendectomy, doctors will observe you for 12 hours before you can be discharged. And upon leaving the hospital after surgery, pain in the area of operation may occur, and it's important to limit physical activity and get a lot of rest. It's also important to watch for signs of infection, including redness, swelling, fever, chills, vomiting, and diarrhea or constipation. Follow-up appointments are needed. So the second one we'll be going over is a cesarean section, otherwise known as a C-section. So why might someone get a C-section? In some cases, a cesarean delivery might be safer for the health of the baby and or the mother. This could be because of a lack of progression in labor, or the baby is in distress, and many other contributing factors. C-sections are not always optional and may occur in emergency situations. And like all surgeries, there are risks for the mother and the baby when getting a C-section, some of which include breathing problems, surgical injury, infection, heavy bleeding, blood clots, and increased risk for future pregnancies. And nearly 21% of births are cesarean sections, so it is very common. So for the surgical procedure, doctors will clean your abdomen, and regional anesthesia is used, numbing only the lower section of the mother's body. Therefore, she can stay awake during the procedure. Surgeons will then make two incisions that are both about 4 to 6 inches. One is an abdominal incision, and the other is a uterine incision. The doctors will then remove the baby through the uterine incision and stitch the incisions with dissolving stitches. It usually takes about 30 to 45 minutes to complete this procedure. And for the recovery process, first, the mother and the baby will stay in the hospital for 3 or more days, depending on how they are doing. And upon leaving the hospital, doctors will show the mother how to breastfeed without causing any additional pain to the area of operation, along with medicine and more to help the mother. It's important to watch for signs of infection with this surgery as well, including breast pain, pain with urinating, fever over 100 degrees, and redness and swelling. And that is all I have for you guys.